This is Veterans Day, and we're honoring the sacrifices made by those who defend our freedom.
Many veterans have died and suffered physical injuries on the battlefield, but the state of veterans' minds going forward is another challenge they deal with.
This morning, we're joined live by Memphis VA Medical Center Chief of Staff, Dr. Thomas Ferguson.
Yeah, we are. Thank you for joining us this morning, Dr. Ferguson. Really appreciate it.
So, good morning. Thank you for the opportunity.
Absolutely. So on this Veterans Day morning, can you tell us about the progress made in recent years when it comes to veteran mental health issues?
Yes, I'd like to start off by just saying thank you for your service to all the veterans who may be listening this morning, and thank you for the opportunity to talk about this important topic. The number one priority of VA, and that's priority overall since 2018, has been prevention of veteran suicide. And so we're really proud to have implemented the initiatives laid out by the various secretaries since 2018. There's been continued focus since 2018, and I would just say that even through the COVID pandemic, we've had great success in reducing the rates of veteran suicide. Certainly, any suicide is a tragedy, but we saw reductions in rates from 2018 to 2020 of nearly 10%, 9.7%. And then, despite the pandemic, we saw an additional reduction in veteran suicides of almost 5%, which is really impressive considering the uptick that occurred during the pandemic. We focus on all aspects of veteran mental health. We've implemented some really novel techniques for working with veterans for trauma-related issues, cognitive behavioral therapy, prolonged exposure therapy, eye movement desensitization. We do journaling, a lot of treatments, a lot of things that have been very exciting for not only treatment of trauma, but suicide prevention.
It's definitely great to hear that there is some reduction there. But what are some of the bigger challenges that y'all are facing that are still there in the ongoing effort to make mental health better for these men and women?
Probably our biggest challenge is the number of people that don't access our system. Roughly half of veterans that are eligible to work with our system have not really interacted with the Department of Veterans Affairs. Challenge is probably that a lot of veterans don't realize that there's actually something out there that we can do. They tend to suffer in silence. There's stigma associated with mental health care, unfortunately. Maybe some veterans even think that it might be kind of weak in some way to access our system, and it's probably the bravest thing that anybody can do.
Gotcha. I believe we have time for maybe one more question. What are can you tell us more about the services available in Mississippi to help vets who are dealing with these mental challenges?
So VA Memphis actually serves about 25 counties in Mississippi. We obviously have our flagship facility in Memphis, Tennessee. Obviously, there's another large facility in Jackson, Mississippi. We've got several community-based outreach clinics scattered across northern Mississippi, including a large facility in Tupelo. We're proud to partner with our community. We partner with the Lee County Veterans Forum, the Delta Task Force in Cleveland, the Grenada County Veterans Coalition, the DeSoto County Veterans Coalition, and we actually have an employee coming in December that's really going to focus on these 25 counties in northern Mississippi to help do outreach with us. So lots of opportunities. We make virtual care options available for folks that might be in more rural areas. Really, we want to give people the care they want in the way that they want it.
Dr. Ferguson, thank you so much for joining us. I've been working on a project dealing with the homeless in Tupelo, and part of it focused on homeless vets. And one person I spoke with who said that they don't reach out for the treatment is because they feel like other people are deserving. So if you at home are watching this and you may need help or know someone who may need help, reach out to the Memphis VA Medical Center. Dr. Ferguson, again, thank you so much for joining us.
Thank you.